cases everywhere.
It is too early to remove a whole bunch of restrictions at the same time.
Saskatchewan announcing a plan Tuesday to lift all COVID-19 restrictions this month, including mask wearing and the elimination of the vaccine passport. With our neighbors to the west returning to normal, should Manitoba be following their lead?
Epidemiologist Cynthia Carr says Manitoba is still in a predicament, with the province continuing to record high case counts.
We're certainly not showing significant progress in reduction in number of deaths.
Manitoba has 697 COVID-19 hospitalizations with 40 patients in the ICU. In the last 7 days, according to Health Canada data, there have been 560 cases per every 100,000 residents in Manitoba. Saskatchewan is double that at 1,090 cases.
It's a little bit puzzling that the province with the highest new case rate in the last 2 weeks is considering these reductions at this time.
Certainly, we're not at a point where this is just an endemic disease.
U of M virologist Dr. Jason Kindrachuk says with hospital numbers, we are not at a point to fully reopen.
Let's not assume that this is now back to baseline and everything's normal. Let's be extremely cautious with where we are.
Saskatchewan Premier Scott Moe says the benefits of providing proof of vaccination no longer outweigh the cost and continue to create division. We see that divide here in Manitoba, with dozens still protesting mandates at the Legislative Building. Mayor Brian Bowman calling a special meeting to address the protest, which he states is unlawful, affecting many Winnipeggers.
Canadians have charter rights for freedom of expression. They have the ability to communicate their views on a whole host of political issues. But what is unique in this circumstance is now day 5 of a disruption of a public street, as well as the noise.
The Winnipeg Police Service responding to Bowman's comments, saying they recognize the disruptions this has on citizens and businesses, but has not seen the level of disruption as other cities have experienced. Quote, the WPS is not in a position to discuss details of our operations, but they are conducted to achieve a peaceful resolution. Carr says we need to push through just a little while longer to prevent a worst-case scenario.
With a virus that is as infectious as it is, we don't want to give up tools. We need to keep tools.
In Winnipeg, Alex Karpa, City News.